projects that you have in your countries, in your associations, for kids, for youth, for promotion of health and physical activity. So let's start with the program because we have 5 presenters here and that will be quite working 1.5 hours. We have 10, 15 minutes, let's say 10 minutes for each presentation or not more than 15 minutes. I hope that it is fine for all presenters. And then we'll have some time probably at the end also to talk. I hope that we'll have time to talk and to discuss and to prepare maybe some future perspectives for our cooperation and for your cooperation. So we start now with the first presentation from Ministry of Health Serbia, Periša.
Years of age and school children and students up to 26 of age. Strategy for Youth Development in Health in the Republic of Serbia 2006 held their objectives: promotion of healthy lifestyles, preservation and promotion of young health, health equity of youth, gender, financial status, ethnic and religious identity, putting the emphasis from health care to health promotion, intersectoral cooperation, active participation of youth, development of personal responsibilities for health and community involvement. School children and young primary health care share of the youth in Serbia in 1997 was 16.6% and in 2017 only 14.7%. So we are aging. We have more adults and small number of young. Staff and services in 2007, 689 doctors of medicine provided health care for 7 to 19 years of age, where 69.1% are pediatric specialists. For one doctor of medicine, it is 1,583 school children. Each child has 3.5 visits, the first is 60%. Young friendly counseling centers formed in 67 healthcare centers, this is primary healthcare centers that is only in Serbia. Include pediatricians, gynecologists, psychologists, social workers, and baby nurses. Their fields are reproductive health, forms of risky behavior, principles of proper nutrition, mental disorders, and asthma, the source of the research of Ministry of Health in 2010. The official Gazette of the Republic of Serbia, issue number 28/09, adolescent health care between 10 to 18 years of age. Their priority issues are insufficient level of healthy lifestyles, obesity, early entry and risky sexual behavior, sexually transmitted diseases, low condom use, etc. Use of legal and illegal psychoactive substances, injuries, violence and peer violence, abuse and neglect. Mortality, 51.3% injuries and poisoning injuries from road trauma, and morbidity injuries and risky behavior, smoking, alcohol, drugs, improper nutrition, sexually transmitted infections. Overall objective, preservation and promotion of adolescent health. Specific objectives, adoption of healthy lifestyles, preparation of health promotion program, 95% covered by systematic examinations and immunization, counseling services in all health care centers, mouth and teeth health as promotional program for preventive dental care. Prevention and treatment of obesity and eating disorders, regular monitoring of body weight, height and body mass index, physical activity promotion, early detection, monitoring and treatment of obesity, as well as formation of teams, pediatricians, nutritionists, psychologists, and endocrinologists. Reproductive health care and promotion, education and motivation of adolescents for safe and responsible sexual behavior, provision of free and easily accessible condoms, confidential and early detection of sexually transmitted infections, as well as for HIV AIDS and teen pregnancy health care training of healthcare professionals. Early detections, treatments and supports of adolescents with chronic diseases and disabilities, preventions of psychoactive substances use, early detections and treatments of adolescents, like informing adolescents and parents about early recognitions, training of healthcare professionals and associates, adolescent treatment teams. Early detections and care of adolescents with mental health problems, like informing adolescents and their parents about early recognition of symptoms, training of healthcare professionals and associates, teams in services for mental health promotion. 7. Violence, neglect and abuse preventions, injury and poison prevention. Training of healthcare professionals on the implementation of general and special protocols, providing psychosocial support, training on non-violent conflict resolution, on injury and poison prevention, early recognition of particularly depressive adolescents. For youth development and health in the Republic of Serbia, health services have to be confidential, high quality, based on needs of youth, performed by motivated, educated, and most important, young, youth-friendly healthcare professionals. Overall objective, health preservation and promotion of youth over the age of 18 up to 26 years. Specific objectives: preservation and promotion of health behavior and risk reduction, develop mechanisms for informing young people about preventive centers, motivate youth to acquire knowledge in healthy lifestyle habits, make available harm reduction programs, introducing health and health behavior monitoring. Through 11 key indicators which are adopted monitoring the database of the Institute for Public Health of Serbia, Milan Milanović Bačić. Adopted indicators for reproductive health, prevalence of psychoactive substance abuse, tobacco, alcohol and drugs, youth partners who use modern contraceptive methods and condoms, sexually transmitted infections, abortions, abuse and suicides. Reduction in youth health disorders through prevention, sexually transmitted infections and HIV, induced abortions, addiction diseases, injuries due to traffic accidents, violence, mental health disorders. Develop capacities of the healthcare system for recognition and timely and proper response to health need of youth. Development of youth-friendly health service that employ educated, motivated healthcare professionals like staff that demonstrate a respectful attitude towards young necessities. Field work with the youth outside institutions, development of healthcare services with youth participation, partnership with youth association, direct development of the Student Healthcare Institute towards prevention, collaboration with faculties, improve hygienic, sanitary and microclimatic conditions in youth facilities. Public health programs of Student Healthcare Institute of the City of Belgrade. There is more project, but this is most important. Internet counseling for sexual orientation issues, early confidential counseling and testing for HIV of students, and project holder is the Student Healthcare Institute here in Belgrade. A program of voluntary testing for HIV, objectives increase in the number of counseled and tested for HIV, especially in persons display risky behavior. Their activities are testing for HIV, hepatitis B and C, cooperation with non-governmental organization, education of students. Leader is Institute for Student Healthcare of the City of Belgrade. Poor nutrition and obesity in children and youth prevention program. Objective is improving the growth and development of children and young by providing conditions for healthy and proper nutrition. Activities are analysis of nutrition conditions of school children, preparation of the program for improving school children nutrition, and prevention of diseases and conditions caused by poor nutrition. Leader is Institute for Public Health of Serbia, Dr. Milan Milanović Bačić. Project Young Reproductive Health Care, objective continuing professional education and skills of healthcare professionals in the field of youth, reproductive health counseling services, and raising awareness of youth on the importance of reproductive health care. Their activities is training of healthcare professionals and associates from health centers on group health education activity in youth regarding reproductive health care and preparation of manual for healthcare professionals and associates. Leader is National Family Planning Centers, Institute of Mother and Child Healthcare of Serbia, Dr. Vojkan Čupić. Project Young Violence and Suicide Prevention activities is training of expert teams in primary health care, physicians, pediatricians, psychiatrists and psychologists, as well as expert teams in schools, psychologists and pedagogues. And Social Services Center on working with young people and build of social network for support and help for the purpose of violence, suicide and suicidal behavior prevention, preparation of manual for violence and suicide prevention. Holder is Institute of Mental Health Belgrade. Project School, and there is also Project School Without Violence. National Program for Drug and Alcohol Abuse Prevention Objective is raising the level of information and knowledge of healthcare professionals and general population. Their activities is training of healthcare professionals and associates in primary healthcare, with special emphasis on adolescents, early diagnosis of addiction, education of drug users and their family members for prevention and early recognition of overdose, strengthening the capacity of health facilities network, development of registry of drug addicts. Holders are Institute of Psychiatry, Clinical and Hospital Center Vojvodina, Rehabilitation Hospital Belgrade, Institute of Mental Health Belgrade, Psychiatric Clinical Center of Kragujevac, Clinic for Mental Health Care, Clinical Center Niš, and Institute for Public Health of Serbia, Dr. Milan Jovanović Batut. Project developments of school for parenting, objective family and its members' health promotion, children health and their proper growth and development promotion, responsible parenting promotion, as well as relationship improvement and interaction of children with parents. Activities, training of healthcare officials and associate on planning and implementation of innovative methods for education of family members in schools. Holder is National Office of Family Health, City Institute of Public Health, Belgrade. National Program for Trauma Prevention and Improving Undertaking Care Services for Traumatized and Injured Persons. Objectives are reduction in incidence rate of injury, mortality, and limited capability for work caused by trauma. Raising awareness of implementation of preventive measures in traffic, school, at work for the purpose of protection against injury. Strengthening the capacity of institutions engaged in acceptance and undertaking care of injury. Activities are establishing the system of unique injury database, trauma registry, preparation of the expert methodological manual of injured uniform monitoring, preparation of the guide for acceptance, transport and undertaking care method of injury. Holder is Institute for Orthopedic Surgery Diseases, Banjica. Activities of Institute for Public Health. They are institutes for public health are organization carrying out of health promotion activity, particularly aimed at vulnerable groups. The activity includes National Program for Population Health Promotion, Program for Population Protection Against Communicable Diseases, implementation of national campaigns for health promotion. They monitor risk factors in the environment that threaten human health through reporting, collection, and analysis of data, including community involvement in solving problems. Prevention and controlling of communicable diseases, including national immunization program, coordination of activities in the field of HIV/AIDS through activities of the National Office for HIV/AIDS. Support of the Ministry of Health to non-governmental organizations in youth health persons. Youth health promotion. Project preventive and corrective work with mentally challenged persons. Objective prevention and correction of physical deformities and decrease in general motor and health capacities of mentally challenged persons aged of 10 up to 26 years. Activities are determination of general motor ability, preventive and corrective exercises, swimming, and preventive or corrective exercises in water. Holders is Association for